So for smoldering multiple myeloma, the risk scoring systems right now, they're based on a one-time snapshot on the disease level when the patient is diagnosed. So what we wanted to assess is how can we have a dynamic risk score? How does this change over time? So we looked into all the patients that had been seen at Memorial Sloan Kettering. So we had almost 400 smoldering patients, and we looked at them over time. So we divided them by quintiles with the markers at baseline, and we saw that obviously those that had high baseline levels of the markers, they had a high risk of progression. But what we then did was that we looked at the change over time in the markers over the first year. So the change in M-spike and the change in the free light chain level. And what we saw there was that those who were in the highest quintile, they had a very high risk of progression. So those with an M-spike change of over 0.3 grams per deciliter over the first year, or an increase in free light chains over 50% over the first year. They also had a very high risk of progression, similar to those with a high baseline level. The hazard ratio was around 3. And the next step that we did was we looked at, of those who did progress over the first year, we saw that 50% of them were in the high baseline group, so the highest quintile of the baseline levels. But then we saw that the rest of the patients, the other 50%, they came from the other baseline risk groups. So there, the change over time really comes into play. And of course, a lot of this is based on genomics. And going forward, we'll have a lot of genomics risk scores, but until we can do genomics assessment in each and every patient, we can look at both the baseline level and the risk then over time. And this is in addition to the 2020 score.